Senator, how'd you vote and why did you vote that way?
I voted for it because it's the right thing to do. We can't tolerate this situation where people can't afford health insurance, and that's if they're lucky enough to be able to get it. And so the whole attempt at this health care reform, health insurance reform, is to make health care available and affordable. And I was so pleased with Olympia Snowe of Maine that she
Senator,
voted.
I'm just going to interrupt you.
Sure.
I'm just going to interrupt you if I can for just a moment, because a lot of people out there are wondering why not the public option. There was a recent New York Times report that seemed to indicate that something like 65% of Americans were for the public option. In other words, the government getting involved in some way, shape, or fashion. And yet your committee resoundingly voted it down. I know that you split your vote. You voted for it one time and you voted against it a second time. Tell the American people why it is that you or your committee believes that the public option is not a viable option to reform health care.
Well, I think public option is a viable option, and it should be in the legislation, and I think we've got a decent chance, once it gets to the floor, of making it a part. It is, and the version I voted for on public option, is to put a government funded insurance company operating under the same rules as all the other insurance companies so that you keep them honest and keep their rates low. And this is for about a quarter of the insured population that is going to be in this health insurance exchange getting new insurance that don't otherwise have insurance now or that they can't afford it. And I think you will see it added.
Isn't this really, Senator, a very conservative principle? I, as an American, do not want to pick up the tab for 47 million people in this country who are uninsured. So a way of making sure that I don't pick up the tab is to tax them for it. If you live in the United States, you should pay for health insurance. The public option provides that. It seems to me to be as conservative a principle as there is. Why then are conservatives consistently voting against this?
Because the insurance industry is against it, Rick. That's as simple as I can put it. And you put your finger on a major part of the overall problem is that all of the uninsured population, which is basically about 20% of the population, they get health care and they get it at the most expensive place, which is the emergency room, and guess who pays for it? All the rest of us do. About $1,000 of our own health insurance premiums per year we are paying for the folks that don't have health insurance. And that's what this bill is trying to straighten out.
My thanks to you, sir. The senior senator from the state of Florida, Bill Nelson. We thank him for coming on and joining us today. From the newest and the newest star on the education system here at the state of Florida, Florida International University.